I will try to paint a picture of how COPD patient in Southern California using the data of severe risk surveillance system. And I would like to thank my co-author, Melissa Pickett. She's in the audience. And also Suzanne. She's here too from the Survey Research Group. And also Masha, she couldn't make it. Without them, I don't think I could do this presentation. I think I should skip this slide since all the experts in front of me have given a very good presentation of what COPD is and how severe this disease is. So this presentation is, like I say, is based on the California Behavioral Risk Surveillance System 2011 data. We call them BURPAS. BURPAS is a cross-sectional random digital diary telephone survey conducted annually since 1984. It's a collaborative effort of the CDC as well as the California Department of Public Health and the Public Health Institute. It provides data regarding health and the related behavior and the chronic disease prevalence mainly for the California adults. So interviews were conducted in English and Spanish. For the first time in 2011, that in addition to respondents were asked, have you ever been diagnosed with COPD? If they say yes, they also ask several follow-up questions about COPD, especially related to their healthcare and the quality of life. We will give the data later if there's findings. All the data I presented today will be age-tested and weighted to the California standard population. So this study is based on the, like I say, sample survey. There was 17,500 people responded to this survey, and about 11,000 of them with COPD. And in Southern California, we met mainly including the county of Los Angeles, Orange, Ventura, and San Bernardino, Riverside, San Diego, and the Imperial counties. There's about 8,000 respondents, and about 500 of them say they had been diagnosed with COPD. But one thing we should keep in mind that lots of people with COPD may be undiagnosed. So they don't know they had COPD even they do. So the prevalence of COPD in California is about 4%. It's a little bit lower than the national rate. And similar in Southern California, and in LA it's 3%, but statistically not that much difference. So in general, there's about 1.1 million California had been diagnosed with COPD. Half of them live in Southern California, and about 1/5 of them live in LA. So these are the several questions were asked or added specifically for 2011 Rose survey. Surprisingly, like in California, even the spirometry tests are the crucial diagnostic tool, as well as also monitoring the progress of the disease. But only like 66% of the respondents say they had such a test. And then about 55% of them say this COPD decrease their quality of life. And also about 43% visit doctor. And it's also, I understand that if you have a COPD, you better visit doctor frequently, at least annually, but look like only 42% say they did. And on the other hand, like about 70% say they visit emergency room. And also only 50% taking medications. I'm not sure. I think the expert may know better. Is that not common or is it not supposed to be the way? It's common. And then for Southern California, I'm sorry. For Southern California, about 70% of respondents say they had a spirometry test. And then 61% say they had COPD has decreased their quality of life. Now let's look at the age distribution. As Dr. Support mentioned, that actually lots of young people do have COPD. Like 46% of them are under age 50. And 33%, a third of them are between age 55 to 64. And only like about 1/5 of them are above age 65. And also, again, majority of them are female, so that's also different as our stereotype COPD sufferer, right? And half of the people suffering from COPD are minorities, and like a quarter of them are Latinos. And 15% of them are African Americans, and about 10% are Asian. In terms of income, lots of them are like 35% of them are below the federal poverty level, which is equivalent to a family income less than 2,400 per month for family of 4. And another 17% are living between 131 to 249% poverty, which is less than 4,700 per month for family of 4. I think those lots of them will benefit from the Affordable Care Act because of that. And 35, a majority of them, 65% of them, are unemployed, either due to joblessness or retirement. And in terms of education and entertainment, that 11% of them has less than high school education, and 25% of them had a high school diploma. For marriage status, 33% of them are single, and 22% divorced, separated, or widowed. So that's understandable, like 15% of them living by themselves, and so which could be an indicator they may not have a social support. So some of the family else Dr. Cooper mentioned may help them monitor the disease and act on it if for something happens. And so this is interesting, important slides. That on one hand, we can see that 40% of people diagnosed with COPD never smoked. So it could be due to the fact that the pollution could be high and they may cause by other factors than smoking. But at the same time, it's 33%, 1/3 of people with COPD are still smoking. So is that problematic? And compared with the 10%, 11% of the general population. So I think it's really, there's a lot can be done to help them to stop smoking. And also, same time, about a quarter of them say they were exposed to household smoke. So someone, if they are not smoking, but someone in their household is not smoking, that's also much higher than the people without smoking. So the organization like your police LA has a, so really also could be an area for intervening. And then we all know that if people with COPD, they do really need to have a good access to care. But 15% of them don't have a health insurance. It's not statistically significant than those without COPD, but it's still a problem, right? If you don't have insurance coverage, then you may not be able easily to access to your care. And then that's also no longer 30% of them say cost is an obstacle to care. And also there's 23% of them have no personal care doctors. And we can imagine if these people don't have a personal doctor to take care of them, they may, unlikely have a well-controlled COPD. And I hope the healthcare reform can help. And then in terms of self-assessment, health status, that's understandable that the people with COPD feel much worse about their health status. So 40% of them say they have poor of their health status, compared with about 18% of the people without COPD. And then also about 30% of them feel poorly about their mental health, compared with 10% of people without COPD. And also for the physical, this middle one is the combination of physical and mental, emotional limitation. 50% of people with COPD feel they have mental, physical, emotional limitation versus 19%. And again, I think Dr. also mentioned about the comorbidities. So people with COPD much more likely to have asthma, heart disease, or feel depressed. And in terms of overweight, obese appear to be high, but not statistically significantly high. But it's also a real problem for people with COPD, about 67% of them hobbies globally. So in summary, the California COPD profile is complex. Many people with COPD are young, women, racial ethnic minorities, and living below 130% federal poverty. These people may benefit from the Medicaid extension hopefully after the healthcare reform, they will have access to treatment. And also Main Street people with COPD have aerosols. And also based on this data, it clearly shows California with COPD will have access to care. They also need a quality of care, like get more regular spirometry tests, and also see doctor regularly, and also the cost barrier should be removed for them. And also there's some intervention like behavior-related intervention, for instance, stop smoking and IP for people, and also efforts are needed to improve their overall health status and mental health as well. Thank you.